Hello, this is a virtual pathology specimen of an adult granulosa cell tumor of the ovary. We are looking at the cut surface, and let me just rotate this to orientate ourselves. So here is the cut surface of the tumor, and this is the capsule of the tumor, which is also the capsule of the ovary. And on the surface here, we can actually see the fallopian tube. Let me just magnify this, and we are able to see the fimbrial end of the fallopian tube, which is pressed against the capsule of the ovary. The capsule is intact and there is no rupture. Back to the tumor, the cut surface appears to be solid and cystic, with these 10 homogeneous areas and also cystic areas. In the fresh specimen, the solid areas may appear somewhat yellow, and this is related to the lipid content of the tumor cells. And the cyst locules may contain yellowish fluid or sometimes mucoid material. If we look carefully, we can also see that there are some areas that appear to be a little bit more friable, and these may represent areas of necrosis. And I'm just going to take you on a brief tour of this virtual pathology specimen, just to highlight the functions of this interactive virtual pathology specimen. It is rotatable as well as magnifiable, and if we play around with the menu, we can actually see some of the labels highlighting the specific aspects of the specimen. Let's learn a bit more about granulosa cell tumor. The granulosa cell tumor is a low-grade malignant sex cord tumor of the ovary, and it is one of the commonest sex cord stromal tumors, which arises from granulosa cells in the ovarian follicles. There are two types of granulosa cell tumors: the adult type, which you see here, which makes up majority of the cases, and the juvenile type. The adult type occurs at the peak age of 50 to 55, so late middle age, whereas the juvenile type occurs in children and younger adults under 30 years of age. Clinically, there may be mass effect from torsion or rupture and potentially hemoperitoneum, and there may also be an adnexal mass. There may, in addition, be endocrine effects, for example, menstrual disturbances, and this can also be associated with endometrial hyperplasia or even carcinoma as a result of hyperestrogenism. This tumor is generally indolent, but it does have a 20 to 30% local recurrence rate after resection. Grossly, these tumors are usually fairly large, about 10 to 12 centimeters in mean size. They are well defined and encapsulated, as we saw, and they are often solid cystic with a tan to yellowish cut surface. The yellowish appearance is seen in more hormonally active tumors because there is luteinization and therefore higher intracellular lipid content. The cyst locules can contain straw-colored fluid or sometimes even mucoid material, and there may be areas of necrosis and hemorrhage. We can see in this fresher specimen that there are some of these dark red areas of hemorrhage. The interactive virtual pathology specimen that we saw earlier, and also these labeled gross as well as microscopy pictures, can all be found in Pathweb, our free pathology online resource. The registration link is in the video description, and registration is completely free. We do have more than 1,000 interactive virtual specimens in this resource. We also have lots of other interactive elements such as quizzes as well as mind maps. And there will be a separate video describing the virtual microscopy features of this tumor. But briefly, under the microscope, we will see variable architectural patterns such as this diffuse sheet-like growth pattern, and sometimes a more trabecular pattern. We can see some broad trabeculae here as well as islands forming the insular pattern. And on high magnification, usually the nuclei are relatively uniform. They are oval and have pale chromatin, and one of the features is that we often will see longitudinal nuclear grooves. Hence, in summary, This is an adult granulosa cell tumor, which is a tumor arising from the granulosa cells, or it is considered a sex cord tumor of the ovary. It often has a solid cystic cut surface and sometimes with areas of hemorrhage and necrosis, and this tumor is usually encapsulated and well circumscribed. It is an indolent, slow-growing tumor. However, it does have a significant recurrence rate. Thank you.